Would she have felt pain? What would she have experienced?
Good question. So, when someone experiences a stroke, as I said, your blood is devoid from going into the brain tissues. So the different part of your brain respond to different functions, right? When you're speaking, it's somewhere else. When you're eating, it's somewhere else. When you're swallowing, it's somewhere else, right? So what happens is if you've got a massive clot or a massive bleed in your brain, it devoids that particular area to do its function. So now I'll give you a very simple yet tricky example. Most of the people write with their right hand. Which part of their brain is more active?
So I think I know this, and I think it's the opposite side. So I
Yes,
think it would be the left side in that.
excellent. So our brain has two basic hemispheres, as we call. So you've got the right and the left brain. Yes, again, job distribution is there, but there's a crossing over of the nerve fibers. So, for instance, if someone is right hand dominated, their left brain is more dominated, and the goes the other way around. So, what happens is, for instance, now someone had a massive clot in their one of their arteries, which you call as middle cerebral artery. So again, your brain has three basic big artery groups: the anterior, the middle, and the posterior arteries. Okay. Most common site is usually the middle side. Okay.
Okay.
So now you've got a massive clot in your middle cerebral artery. What happens is the areas which are working day and night to make you work go off suddenly. So it's like, in a simple way, if you may say, it's a power failure. Okay. And that responds in a way that suddenly you lose power on your right side. The bigger the area which is getting devoid, the more the symptoms. Many people have clots in very proximal, very not proximal, very distant form of the blood vessels, as in they're going and supplying the superficial areas in your brain. So the symptoms would be a bit less. The more they involve the bigger blood vessels, the more symptomatic the person is. So, good question whether they feel pain. Most of the people do not feel any pain,
That's good to know.
but it's not good as well because you can see your hand lying on your bed and you can't lift it. Think about the implications one might be going through when they can see that their hand is there, they can't feel it, they can't move it, and it's not responding to them. I feel it is an absolute catastrophic feeling that one person would be going through.
Mm.
But unfortunately, that's what stroke does.